The Affordable Care Act changed the way we shop for healthcare. King versus Burwell, a case soon to be decided by the Supreme Court, could change all that again. Right now, some Americans, like people with pre-existing conditions and new immigrants, can get financial help when they're out shopping for health insurance. Many have already benefited from the government subsidies and the expansion of Washington welfare programs like Medicaid. On the other hand, millions of Americans lost their plans, lost their doctors, or had their rates increased to subsidize other people's plans. Many have had their work hours reduced and lost their insurance altogether. The language of the law encouraged, but didn't require states to set up exchanges or marketplaces where people in those states could shop for coverage by Washington-approved companies. The law authorized the IRS to offer subsidies and applied penalties to people who shop for insurance this way. Many states determined that these exchanges didn't work for them and that it was best for the people to find policies they liked directly or shop for them on the national exchange. After a majority of states decided not to, the IRS went ahead anyway and applied its rules to everyone in every state, no matter what people in those states worked out for themselves. The court will resolve whether Congress or the IRS gets to write our laws. If the court rules in favor of people suing the government, the result could essentially be the creation of two American healthcare systems. People in 37, mostly Republican states would no longer be subject to Washington's mandates and penalties. In those states, job creators, nearly 250,000 with 57 million employees, would be free to increase the hours employees can work without being penalized by the IRS. Those in Democratic states would continue to choose from the more expensive policies allowed by Washington, and up to 6 million of them would still be liable for financial penalties. Would it mean the death of President Obama's landmark law? Probably not, but Americans could begin to have vastly different levels of choice in healthcare. It all depends on which America they happen to live in.